All right, let's talk now about the larynx more specifically. The laryngeal skeleton is made up of four pieces of hyaline cartilage. We have a thyroid cartilage, we have a cricoid cartilage, and we have two arytenoid cartilages. And then we got one elastic piece of cartilage, and that's the epiglottis. All right, that's a lot of stuff. The thyroid cartilage is the one that goes anteriorly into a ship, sort of like a proper ship-like shape that's known as the Adam's apples. And you can feel the Adam's apples in the front of your throat. If you touch it, it's a little pokey thing. And then behind to the back, it opens. On the inside, inferiorly, in the inferior horn, it's connected to a signet-shaped ring shaped cartilage called the cricoid cartilage. And what that means is basically in the back it's a big cartilage right here. This is from the back, so this is the cricoid cartilage. As it comes to the front, you see it down here. As it comes, it gets narrower. So they call it signet shape because you can stick your finger through it, and it's like narrow on the bottom, and on the top it looks like you went to a really prestigious school or something. This is the thyroid cartilage here as it comes to the tip, to the front, and the front is where we can feel it. Up here on top, we have the hyoid bone, and then as we get behind that hyoid bone up there, we can see the epiglottis. But I get ahead of myself. So we have the cricoid cartilage below the thyroid cartilage, and then on the back of that, we have on top of here the cricoid cartilage, we have these two arytenoid cartilages attached to it. These are the arytenoid cartilage, these little two things right here on each side. They're small and they can rotate. They can move inward and outward, and they have a little horn going to the front here. This is from the back to the front. And on those horns we have these strings attached, these vocal cords, and then those go forward and attach to the back of the thyroid cartilage. There you have it. Look at that. The arytenoid cartilages have a vocal process pointing forward, and vocal cords run from there to the inside of the thyroid cartilage. And then muscles that attach to those arytenoid cartilage from those different processes of the arytenoid cartilage rotate the arytenoids onto the vertical axis, around the up and down axis. And when that happens, it does this. This is from above down up here. So what you see here, you see the arytenoid cartilage close, and then you see these tips come a little further outward, and that opens these bands that come from the back to the front of the from the arytenoid cartilage to the back of the thyroid cartilage, which is in the front really. So now when air goes through these from below here, which is the inside of the lung, through to the outside of our mouth, it passes through this area, and these vocal cords here, they will vibrate. And that's called phonation, because what we do there is we create voice then at that point. And a change in tension of these cords, depending on how wide that hole is, that glottis, that's actually the hole that goes through it, that changes the pitch. Vowels are made within the larynx, the A, O, I, O, E, U, that stuff. The consonants are made how we hold the palate, how we hold the tongue, and how the teeth and the lips move. And the strength of the airflow determines the loudness of the voice. Also, as we've seen before, the sinuses do that as well. There you go. That's your voice box. Then the epiglottis is attached to the backside of the thyroid cartilage, and it points upward. And when we swallow, muscles that are attached to the hyoid bone, that was the bone above it, you can actually feel it under your chin. Behind there you got a bone that if you squeeze it from side to side, you squeeze it, it hurts a little bit. So that's a bone. So that's the hyoid bone. And as we swallow, muscle attached to that bone raise and lower the larynx up and down. And this brings and the epiglottis stays in place. And so what happens effectively, the epiglottis moves downward and closes the glottis, that hole into the lungs, when we swallow. And that's great, because what that does, it prevents aspiration of food into the trachea. The trachea is going to be the next space as we travel into the lungs. We only want air to go down there. So we don't want food to go down there. And aspiration of food means food goes down there and then we choke. And that wouldn't be a good thing. Once in a while it happens and we have some problem with that. But for an ongoing thing, that would be horrible. Oops. That was a little fast, huh? Okay, then we get to the trachea. So now we leave the upper airways, where we have a combination of different things traveling through, and now we get into the lower airways and the trachea, and then we got the bronchi, and then we got the lungs. So the trachea is a tube with about 20 horse-shaped rings that it's connected by ligaments in the back. These rings don't close in the back because what happens is the windpipe is right here. The food pipe is right here. The food pipe is going to be called the esophagus. The windpipe is the trachea. So only air needs to be traveling through here. We have these rings because air is not that strong to push a tube open all the time. Food can do that. But if the air will go through the esophagus here, that would make it really hard to breathe compared to going down here. And so the air needs some help to keep that tube open so we can get the air through it. So that's done by those tracheal rings. And they're horseshoe shaped because if they're not open in the back, if it would be going all the way around, it would be really hard to swallow. Because when we swallow food, this tube here, the esophagus, needs to expand, and it can expand into the trachea that way. And that's very helpful. So that's why they're open in the back. So that the food has an easier time going through. When we then go down here, after these rings come, we have at the bottom, we have one place that we need to split, because we're going to have a lung on the one side, on the right side, we have a lung on the left side. And so the carina is an area where we bifurcate, that means we split, from one we make two, we bifurcate the trachea into two main bronchi. And then those pass into the lungs. The one on the right here, this one, is a little bit more prone for foreign bodies to fall into it because it is wider and it is more vertical. The aortic arch runs above the left bronchus, and that left bronchus and the pulmonary trunk divides there. All right. Then we get into the bronchial tree. We have a main bronchi, one on each side, and then that divides into lobar bronchi and then into segmental bronchi. Further, we make it into finer branches ending in terminal bronchioles, which are very, very fine. Look at all these things. Look at this bronchial tree. These little end things are very, very small. The terminal bronchiole will feed into respiratory bronchiole, and then from there we get into an alveolar duct. So that's just a whole bunch of words. But once we get to the alveolar duct, we get into from there we have alveoli coming out. So if you actually zoom into this bottom picture here, you see the terminal bronchioles, and the respiratory bronchioles, and then the alveolar duct. Once we get into the respiratory bronchioles, we start having some respiration happening. That means somewhere in there we start having the oxygen go into the bloodstream. And so that's why we call it respiratory bronchioles, because we already have some respiration taking place there. All of the bronchi, excluding the smallest one, excluding the bronchioles, have cartilaginous rings, like the trachea. Those keep the bronchioles open. Except the bronchi, they have the full rings. They don't need to keep it open in the back, because we don't need to compromise that space ever there.